Hello everyone, this side Dr.G and today we are going to study about the head and neck embryology. So let's start. We already know we have three layers, right? Yes, we have the ectoderm. Let us suppose this is the ectoderm, okay, ectoderm on both sides, right? We have the mesoderm that I am drawing with other color, right? Let us suppose this is the endoderm, and in between the ectoderm and the endoderm, we have the mesoderm, right? We have the mesoderm. So let us just mark this. This is the ectoderm. This is the endoderm, okay, on both the sides, and in between the area which I am highlighting right now, it is the mesoderm, right? It is the mesoderm. Let us suppose this is the mesoderm over here. So on both the sides it will be present ectoderm, endoderm and mesoderm. Now let us study about the development of this pharyngeal arches, right? Pharyngeal arches. Yes, we are going to discuss about the pharyngeal arches. For your reference, I am taking only one side over here and I will just show how these pharyngeal arches, the endodermal pouch and the ectodermal clefts are formed. So let us suppose that this is the, I'm just taking one of the sides over here. Let us suppose the black one which I have highlighted, it is the ectoderm, right? I'm just taking this particular side. Outermost part will be the ectoderm, right? So yes, there will be constrictions over here. Four and 5, right? And we will also have the endoderm, right, over here, like this. So you already know the ectoderm will give rise to ectodermal cleft, okay? There will be a cleft which will be formed. It is called as the ectodermal cleft. Ectodermal cleft, right? We have the first ectodermal cleft, the second ectodermal cleft, the third and the fourth. Similarly, we will have the endodermal pouch over here. We will have the endodermal pouch. Endodermal pouch, right? Now these pouches will be also 4 in number, right? 1, 2, 3, 4. Okay, and in between you already know we have the mesoderm, right? So the mesoderm will give rise to the arch that is called as the pharyngeal arch, okay? The inner part, okay, it is the mesoderm, right? You can highlight it completely, right? So this will give rise to this particular mesoderm. Yes, so this is called as the this is the arch developing in the mesoderm. So this is called as the pharyngeal arch, okay? So pharyngeal arches are basically developing from the mesoderm. So it is bilateral, guys, right? It is bilateral. It will be developed on both the sides. So yes, I'm just taking one side to show you, right? So it is in pair. So this is in the middle. This is the pharyngeal arch. Pharyngeal arches. And remember, the pharyngeal arches are 6 in number. 1, 2, 3, 4, 5 and 6. The pharyngeal arches will be like 5 in number. Initially there are 6, but you already know that the 5th pharyngeal arch basically disappears. So there is the 6th pharyngeal arch which will be there. So remember over here we have a remnant, okay? We have a remnant of the 5th arch, okay, remnant of the 5th arch, and this remnant it is called as the ultimobranchial body. Okay, this is called as the ultimobranchial body. Ultimobranchial body, right? So yes, we have 4 ectodermal clefts as of now, endodermal pouch, and the 5 pharyngeal arches. 5 pharyngeal arches will be 1, 2, 3, 4 and 6. The 5th one disappears, and yes, it is the remnant over here which you can see, that is the remnant of the 5th arch, which is called as the ultimobranchial body. Now coming on to the derivatives. Of these cleft, pouch and arches, right? What we will get from these cleft, pouch and arches. So let us draw the same diagram again. Yes. So we have the ectodermal clefts, right? Ectodermal clefts. And we have the endodermal pouches, right? Now, in between we have the pharyngeal arches, right? So let us just mark this first. Okay, you already know we have the ectodermal clefts over here. Okay, let me choose the same color code. We have the ectodermal clefts, and we have the endodermal pouch. Endodermal pouch on this side, right? Endodermal pouch on this side. Now, what will happen? Mesoderm present in the second pharyngeal arch, right? Mesoderm which is present in the second pharyngeal arch. What will happen? It will overgrow, right? It will overgrow. Okay, it will yes, it will overgrow, and it will push the ectoderm outside. Okay, it will push the ectoderm outside. So let us just support this. Yes, the mesoderm in the second pharyngeal arch. Okay, it will grow like this, right? Let us just highlight over here. So this is the mesoderm in the second pharyngeal arch. It will grow, okay, and will push the ectoderm onto one of the sides, right? It will push the ectoderm onto one of the sides. So yes, what it will do, the ectoderm outside will be taken down and down, okay, and will attach to the epicardial ridge, okay, where the heart is developing. Okay, it is will be attached to the epicardial ridge where the heart is developing. So yes, remember that the mesoderm, this is the second arch, right? This is the second arch, right? And just basically draw this a little broad, the 6th one also, right? So yes, it's like this. Okay, so yes, this is the second arch. So remember, the mesoderm present in the second arch, basically it will grow, push ectoderm, okay, on one side. It will push the ectoderm down, and this ectoderm will be attached to the epicardial ridge, right? It will attach to epicardial ridge, right? So it will obliterate the other clefts also. We can see the first ectodermal cleft. It is the first ectodermal cleft, but all the other clefts will be obliterated, right? All the other clefts, if you just want me to mark, yes, these all will be obliterated. Why? Because the second arch mesoderm, it is growing and it is getting this ectoderm down, and it is blocking all the arches, okay, all the clefts, right? So yes, the area in between okay, the ectodermal cleft and this, the ectodermal cleft and this, the first ectodermal cleft which is growing like this, okay. The area between this, okay, it is called as the cervical sinus, right? It is called as the cervical sinus. Now this sinus, if it is persist, okay, if it persist, it is called as the brachial cyst. It is called as the brachial cyst, right? So it is a fluid filled cavity, right? Brachial cyst is nothing but a fluid filled cavity. It is a fluid filled cavity, right? So yes, basically it is like you can say it is a very harmless, painless swelling which is present along the sternocleidomastoid muscle along the anterior border. So if you want, you can write this also. It is a harmless, painless swelling. Okay, it is a harmless painless swelling which is present along the sternocleidomastoid. Okay, present along sternocleidomastoid, right? It is just the anterior border, along the anterior border. So now what we will get from the first ectodermal cleft, rest other are obliterated. So the things that we will get from the first ectodermal cleft, it is the external acoustic meatus. Remember, it is the external acoustic meatus, and we have the outer membrane, okay, outer part of, or the outer membrane of the tympanic membrane, right? So that is something which we will receive from the first ectodermal cleft. Now coming on to the first endodermal pouch, right? Coming on to the first, okay, this is the first endodermal pouch. Now first endodermal pouch, see the external ear, okay, the acoustic meatus and the outer part of the tympanic membrane, it is coming from the ectodermal cleft. So yes, the part of the middle ear, that is the, yes, middle ear you will get, okay, the cavity, plus you already know in the middle ear what is present, eustachian tube you will get, okay, plus you will get the inner layer of tympanic membrane, So that is the derivatives of the first endodermal pouch. Now coming on to the second endodermal pouch. Now in the second endodermal pouch you will get the epithelium, lining epithelium of the palatine tonsil. Lining epithelium of palatine tonsil. Lining epithelium of the palatine tonsil. The third endodermal pouch, it will give rise to the thymus and the inferior parathyroid gland. Again remember, it is the inferior parathyroid gland, right? So yes, it is the thymus and inferior parathyroid gland. And the fourth endodermal pouch, it will give rise to the superior parathyroid gland. It will give rise to superior parathyroid gland. Right, it will give rise to the superior parathyroid gland. As you already know that the thymus, it is a part of the anterior mediastinum, right? It is a part of the anterior mediastinum. Now what this thymus will do, it will take this parathyroid gland which is developing down. So it the thymus anyways has to migrate downwards, okay, and along with it, it will take this parathyroid gland, and that is the inferior parathyroid gland. So there are chances of ectopic parathyroid more in cases of like you can see over here, right? So yes. Now coming on to the pharyngeal arches, you already know the pharyngeal arches basically are they are developed from the mesoderm, right? So now coming on to the pharyngeal arches. Now firstly we will learn like which nerves are actually supplying these pharyngeal arches. So how many pharyngeal arches are there? They are 5 in number, but actually they are 1, 2, 3, 4 and 6. The fifth one will be vanished off, right? Okay, it will disappear. So the first pharyngeal arch, okay, the first pharyngeal arch, it is basically supplied by, okay, it is supplied by the mandibular nerve, okay, that is the part of the trigeminal nerve, the third part of the trigeminal nerve. So we have this mandibular nerve, okay. Then we have the second one, which is getting supplied from the seventh nerve, okay, the seventh cranial nerve. Then the third one getting supplied from the ninth cranial nerve. Then we have the fourth and sixth, basically they are supplied from the vagus nerve, okay. The branch of the vagus nerve which is supplying the fourth part, it is the superior laryngeal nerve. Superior laryngeal nerve, the branch of the vagus, right? So it is branch of the vagus nerve only, and we have the inferior laryngeal nerve. Inferior laryngeal nerve, that is also a part of the vagus nerve only, right? Repeating the last point again. So yes, we have the recurrent laryngeal nerve, that is a part of the vagus nerve only, right? The branch of the vagus nerve. Now from the seventh part, right? From the seventh part, okay, you already know the seventh, it is the facial nerve, right? From the seventh, basically there will be a nerve which will supplying the first pharyngeal arch, and this nerve it is called as chorda tympani. Okay, they are called as chorda tympani. It is a pretrimetric nerve because this branch it is going backward. Okay, so that is from the facial nerve a branch will come and it will supply the first pharyngeal arch, and that is the chorda tympani. Now coming on to these pharyngeal arches, what are the derivatives of these pharyngeal arch? So let us just write it down. The first arch derivatives. So you should remember the nerve which is supplying to the first arch, it is the mandibular nerve, right? And the branch from the facial nerve, that is the chorda tympani. The chorda tympani. Okay. What about the muscles that you will receive from the first arch? Yes, we have the muscles of mastication, muscles of mastication. We have tensor villi palatine, tensor villi palatine. We have tensor tympani muscle, right? We have tensor tympani muscle. We also have like the anterior belly of digastric. And we also have the mylohyoid muscle. Mylohyoid muscle, right? So these are the muscles which will be derived from the first arch. Apart from that, if we talk about the cartilages and the bone part, right? The cartilages and the bone or the ligament which are derived from this first arch. So you have to remember with the help of a diagram that I will draw for you, right? I will draw a diagram for you. So let's just try to remember from this particular diagram. Now let us suppose this is the mandible, right? This is the mandible. Okay, so I'm just trying to show one part over here, right? This is the mandible. So the mandible, it is developing from the first arch, right? The mandible, it is developing from the first arch. Okay, we have a ligament over here. Okay, we have a ligament over here that is connecting the mandible to the spine of the sphenoid bone. So that is called as the spinomandibular ligament. Okay, so this is the spinomandibular ligament. Spinomandibular ligament. We also have like the sphenoid bone, and which part of the sphenoid bone? That is the spine of the sphenoid. Spine of the sphenoid. Okay. Then we have a ligament coming from the mandible, and this ligament, it is called as the anterior ligament of the mandible. Okay, it is called as the anterior ligament of the mandible, right? It is called as the anterior ligament of the mandible. Repeating the last line. We also have a ligament that is coming from the malleus. Okay, it is also called as the anterior ligament of the malleus. Anterior ligament of malleus, right? We have the malleus bone. We have this malleus bone, which you can draw like this, right? So this is the malleus, and also the incus, right? Also the incus, it is also developing from the first arch, right? So we have this incus bone also, which is developing from this first arch, right? So these are all the structures that are developing. Mandible. Okay, so let us remember this. Yeah, the mandible, the spinomandibular ligament, the spine of the sphenoid, malleus, incus, and anterior ligament of the malleus. Anterior ligament of the malleus, right? Now coming on to the artery which is supplying over here. The artery which is over here, right, which is developing, right, that is the maxillary artery, right? It is the maxillary artery, right? So that is about the first arch derivative. Now coming on to the second arch, derivative. Now the second arch derivative, basically firstly you should know the nerve which is supplying the second arch. It is the facial nerve, okay, the seventh cranial nerve, or commonly like it's the facial nerve which is supplying the second arch, right? So what are the muscles that you will get over here? What are the muscle derivatives? The muscles, remember we have the facial muscles, right? We have stapedius, we have posterior belly of digastric, we have stylohyoid, auricular muscles, and occipitalis muscle, right? Auricular muscles and occipitalis muscle. Occipitalis muscles, right? Over here the bones, cartilage, and ligament that you will get. So let us write about the bones, cartilage, and ligaments that you will get over here. These are the stapes. Okay, malleus incus first arch से था, तो malleus incus stapes कहाँ आ जाएगा? Yes, it is the second arch derivative. Then we have the styloid process. We have stylohyoid ligament, and we have the lesser cornua and upper body of thyroid. Lesser cornua and upper body of thyroid. Now the artery which is supplying over here, it is the stapedial artery and the hyoid. Repeat कर रहा हूँ last line. The artery which is developing over here, like it is the stapedial artery, and remember it is the hyoid artery. Stapedial artery and hyoid artery. Coming on to the third derivative, Coming on to the third derivative. So you already know we have the nerve which is supplying, that is the glossopharyngeal nerve. The ninth nerve, that is the glossopharyngeal nerve. The muscle which will be developing over here, it is the stylopharyngeus muscle. Okay, the bones, cartilage and ligament. Over here you will get the lower body and the greater cornu of hyoid bone. So the bone, okay, which is you will get over here, it is the lower body and greater cornua or the greater cornua of the hyoid bone, right? And at last the arteries which are developing over here, the common carotid and the internal carotid artery. It is the common carotid artery. Common carotid artery and the internal carotid artery. Now coming on to the fourth derivative. Right, the fourth derivative, basically the nerve which is supplying over here, it is the superior laryngeal nerve, right? The part of the branch of the vagus nerve, that is the superior laryngeal nerve. The muscles, okay, which you will get over here, it is the cricothyroid muscle. The muscles of the palate, except tensor villi palatina, okay, except वो तो पहले वाले से आ गया ना, tensor villi palatine. Okay, we have the muscles of pharynx, except the stylopharyngeus and cricopharyngeus, and cricopharyngeus muscle, right? So what is developed over here? Like these are the cartilages. Okay, the derivatives of the fourth arch, we have the cartilages, and these are the laryngeal cartilages. And the arteries which we will get over here, yes, the artery which we will get over here, we have the arch of aorta, and right subclavian artery. Coming on to the last one, that is the sixth arch derivative. So it is supplied by, the 10th or the vagus nerve, and which branch? It is the recurrent laryngeal nerve. Right, what the muscles you will get over here? Okay, it is the cricopharyngeus, okay, and all muscles of larynx except cricothyroid. All muscles of larynx except cricothyroid, right? You will get all the laryngeal cartilages over here. So the bone part remains the same, the bone or the cartilage part. Over here you will only get the laryngeal cartilages. From all the laryngeal cartilages, basically the developing from the fourth and the sixth arch, right? So we have the laryngeal cartilages. Yes, and the fourth one, that is the artery. And remember, we have the pulmonary artery and ductus arteriosus. So that was about the arches, okay, the derivatives, the nerves, the muscles and the artery. So we have talked about all the clefts and this. So thank you.